HPV, or the human papillomavirus, is a sexually transmitted disease transmitted through intimate skin-to-skin contact, but can infect almost all human skin surfaces. With more than 80% of all genders acquiring it by the age of 45, the prevalence is highest among women younger than 25 years old, and most men are asymptomatic carriers. But an infected person who has no visible signs or symptoms can still spread it. Cervical cancer is the second most common cancer among women worldwide, with nearly 200,000 women diagnosed with cervical precancerous cells every year. For men, the cancer in the back of the throat is the most common. Some risk factors for HPV include the frequency of sexual intercourse, early sexual activity, number of lifetime sexual partners, the use of birth control pills for more than 5 years, as it increases the risk of developing cervical cancer in women who have HPV. And the last risk factor is weak immunity. There are several types of HPV. The high-risk HPV are cancerous, HPV 16, 18, 31, and so on. These can cause cervical cancer. The low-risk HPVs are non-cancerous. These include HPV 6, 11, and 26, and so on. These can cause about 90% of genital warts. HPV 1, 2, and 4 cause other skin warts, such as plantar warts on your feet. Most cases of HPV clear after 1 to 2 years as the immune system fights it off. You can still be infected by other types of HPV during this time. CIN is cervical intraepithelial neoplasia. It refers to cervical dysplasia, which is the presence of cell of an abnormal type within a tissue. There are several severity levels involving the abnormal tissue. CIN1 is low-grade neoplasia and 1/3 of the thickness of the tissue. CIN2 is mild neoplasia and about 2/3 of the thickness of the tissue. CIN3 is severe neoplasia and more than 2/3 of the thickness of the tissue. HPV testing and treatment. For women, HPV testing is done during a pap smear test, which looks for precancerous and cancerous cells. A colposcopy is a magnifying tool to look at the vagina and cervix. A LEEP procedure is to remove abnormal cells from the cervix. It is used for either treatment or diagnosis of cervical cancer. Cervical biopsy is a procedure where a provider takes a sample of tissue from the cervix to look at under the microscope. Cryotherapy is the freezing off of cancerous growths. For men, there is currently no routine testing for HPV as it is not recommended by the CDC. However, there are treatments for symptoms present in men, such as prescription creams. For prevention, screening alone does not protect from HPV cancers. However, HPV vaccination is 100% effective at prevention. Gardasil is approved for ages 9 through 26, but it is not recommended for 27 years of age and up, because vaccination becomes less effective. Currently, a quadrivalent vaccine, meaning protects against 4 different antigens, stimulates an immune response against HPV 6, 11, 16, and 18. The vaccination takes place in 3 series. Initially, at the 2-month mark, and at the 6-month mark. It does not alter the course of disease that was present prior to vaccination. For men, Gardasil 9 is a vaccine that is recommended.